Hello, everybody. You're very welcome. We're just letting people in now, so we'll start in another minute. Okay, we'll get started, everyone. So good afternoon, everyone. My name is Faye White, and I'm the Women's Health Officer at the National Women's Council. You're all very welcome to this webinar today to learn about the current review of the abortion law and how you can submit to the public consultation. 4 years ago, the people of Ireland decided it was time to end the years of secrecy and shame around abortion and enable women and pregnant people to access vital healthcare in their own country. The National Women's Council is the chair of the Abortion Working Group, which is a group of over 20 civil society organisations and healthcare providers. And we know from listening to women since the law came into effect that there are still significant barriers to accessing abortion. The law is being reviewed for the first time, and this is a critical opportunity to achieve better care for women and pregnant people. As part of the review, there is currently a public consultation underway, which anybody can submit to. We really need as many submissions as possible that support enhancing abortion care provision across the country. It is important to remember that as the consultation is open to anybody, there will also be submissions from people who do not support abortion. So it is vital that those of us who want to see improvements to abortion access come together and have our voices heard to send a strong message to government that these changes need to be made urgently. Yesterday, the National Women's Council launched new nationally representative research conducted by Opinions Market Research, showing significant support for key asks around decriminalisation, access to care at home, and safe access zones. 80% of people agree that no woman in Ireland should still have to travel abroad to access abortion care. 85% agree all individuals accessing and providing abortion care should be protected from threats, harassment, and abuse from anti-abortion protests. 71% agree abortion should be treated like any other medical procedure and should not be a matter for criminal law. So we know that support is there, and this is the time for us to show that support by submitting to the public consultation. We know that it can be quite challenging to navigate how to do this and the public consultation form. So we put together a quick guide to making your submission to ensure that all the information you need is in the one place. So in this webinar, I'll be taking you through that guide to try to make this as easy for you to submit as possible. So before I do this, I'm delighted to be joined today by some expert speakers who are going to be sharing their perspectives. So first up is Sinead Kennedy. Sinead was the co-founder with Alva Smith of the Coalition to Repeal the Eighth Amendment. She was also the head of research for Together for Yes, and her most recent publication was Repealed, Ireland's Unfinished Fight for Reproductive Rights with Camilla Fitzsimons. So Sinead, I'll hand it over to you.
Thanks very much, Faye. Thanks for inviting me to contribute to this really important webinar. And thank you to all of you who've turned up in your lunch break to listen to us today. So I just want to just very briefly ask us just for a few minutes just to cast our minds back to that kind of wonderful energy and the vitality of the repeal campaign, the campaign that really caused, what I would argue is one of the most important political and social transformative moments in recent Irish history. It literally transformed the country in which we live in. And I think it's important to remember that, because I imagine that many of you who are sitting here listening to this, to us today, we're part of that energy. You were the people who created that change in our society. Because the repeal campaign, one of the things I think that makes it such an important campaign was that it was a grassroots activist-led campaign, a campaign that was led largely, but not exclusively, but well, the leadership at every level, I think, was by women at a grassroots level, and also in terms of the national campaign. Of course, men played a role in that, but it was noteworthy that so much of the kind of energy, leadership, vitality of that campaign came from women. It also, I think, it was a result of, I think, the bravery of many people, of many women and couples who came forward and told their experiences of having, of being prevented from being able to have an abortion in Ireland, of having to travel abroad to end an unwanted pregnancy, or in cases of fatal fetal anomaly, to very painfully end a very wanted pregnancy. And again, I think those the bravery in telling those experiences, in talking about pregnancy, in talking about abortion, things that had often been historically shrouded in shame and secrecy, also played an enormous role in transforming the society in which we lived in. So I think it's important, I think, to remember what we achieved, because I think sometimes when we talk about how the Act is working, and in many cases how it's not working, and how it's, as we'll see today, how it's not working for so many people, particularly marginalized and vulnerable people, it's easy to forget what we did achieve. And I think if we could repeal the Eighth Amendment, there's a kind of sense, I often think, that there isn't anything that we can't do. And we can therefore create a more just and equitable abortion regime in Ireland. Thanks very much.
Thank you so much for that, Sinead, for that really important context. I think you've really shown us what we can achieve when we come together, and just like every vote counted in 2018, every submission counts for this public consultation. So no voice is too small. We need as many people as possible to come together on this. So thank you so much for that reminder. Next to speak is Sydney Colkin from the Abortion Support Network. In Sydney's volunteer life, she has been a member of the Abortion Support Network phone helpline team since 2018. In her professional life, she is an academic at Queen Mary University of London. Her research looks at impact of self-managed abortion with pills in countries with very restrictive laws, including Ireland before repeal. And Sydney is going to speak about the work of the Abortion Support Network. So Sydney, I'll hand it over to you.
Okay, thank you very much. Thanks for having me, and I'm really delighted to be representing ASN today. For those who don't know Abortion Support Network, we provide logistical support and financial assistance for people who need to travel for abortion. As Faye said, I've been working on the phone team at ASN since 2018, so I've had the benefit of seeing the kind of calls we got and clients we saw before the new law came in. And then as well, I've been able to see what the change has been. I mean, as Sinead mentioned in her remarks, the change has been enormous. We have many, many fewer clients from Ireland, but we still do get multiple calls from people in Ireland every week. And that's part of why your contributions in the consultation are so important, because the law is worlds better than what was under the Eighth, but it could be improved. So I want to tell you about three groups of people who we still hear from at ASN, and specifically from Ireland. So the first is we still hear from people who scan just over the limit. People who didn't know that they were pregnant until they were right at the limit just a few days before. And it's worth noting that the 3-day mandatory waiting period and the requirement for being sent for an ultrasound scan pushes people over the limit. I see somebody's question in the chat, are Irish women still traveling to England for abortion? The answer is very much so. Yes, they are. The second group of people is people who've had multiple rounds of medication abortion pills that didn't work, or people who want to travel for surgical abortion because they can't use pills or they don't want to. And people really don't have a choice of method in the Irish system right now, which is quite important. So we see people who've had multiple rounds of pills or people who've had pills and have then been pushed over the limit when those don't work and they're sent abroad. Mara Clark, our founder, wanted me to mention to you that our kind of buzz phrase for this situation is when people have an abortion started in Ireland that can't be completed in Ireland and they're sent abroad, we're calling that state mandated medical negligence, just to give you a sense of the gravity of this situation. The third group of people who we're still seeing on the phone lines every week is people who have pregnancies with fetal anomalies that are very serious, but aren't serious enough to receive care at home in Ireland. So the new law is quite restrictive about what kind of fetal anomalies actually qualify for abortion. And there's been good research showing, like academic research, but also just anecdotally from us. A lot of doctors are quite reluctant. They don't really know where they stand in relation to the law, and they're quite reluctant to do something that will put them on the wrong side of the law. So there are still people who are being told by their doctors in Ireland, your pregnancy has really grave fetal anomaly, but there's nothing we can do for you here and you have to travel abroad. These are obviously really difficult cases. People feel abandoned by their doctors. They feel a lot of dread about traveling. They have to deal with really heart-wrenching questions about if or how they bring fetal remains home, how they explain to family and friends why they have to travel, and of course, how they get the hundreds of euros that it costs to do that. Traveling is easy for a very small number of people, but for most people, it's quite difficult to travel for abortion. The biggest obstacles people face include, not having the money, not having the ability to get time off work, not having childcare. Most people who are getting abortions are already parents, so they have to arrange for childcare while they go. People in, relationships where they're controlling or abusive relationships can't travel easily. And of course, there are people who need visas to travel, even visas to come to England or to go to Holland to access abortion. And those are very, very difficult. Just the last thing I want to mention is that when the Irish law changed, ASN did some research about the number of people that we estimated would continue to travel, need to travel after the new law. And we estimated that there would be between 600 and 800 people per year who would still have to travel for abortion after the new law. But the numbers of people that we're seeing are quite a lot lower than that. So we're quite concerned that there are people who are kind of falling through the cracks and still being left behind by the new law and aren't able to travel to England. So thank you for having me, and I'd be happy to answer any further questions in the Q&A period.
Thank you so much for that, Sydney, and for the work that you're doing in ASN. It really is tremendous, and you shouldn't have to be doing that work. I think we can all agree this is not what we voted for in 2018. There should not be women still traveling, but you're providing a really vital service. So I just want to thank you for that. So next up to speak is Julie Helen from Inclusion Ireland. So Julie is going to speak to us about the plain English version of the quick guide that they have developed. Julie is Communications and Information Manager with Inclusion Ireland, where as part of promoting the rights of people with intellectual disabilities under the UN CRPD, she leads on promoting the creation of and access to accessible information. So Julie is a disabled woman herself and a working journalist who has also worked in disability services. So Julie, I'll hand it over to you.
Thanks a million, Faye, and thanks for inviting us here to speak today. I won't be very long at all, but I suppose the reason we wanted to contribute was that having plain English information around difficult and sensitive and challenging subjects is really important to Inclusion Ireland and to disabled people in general. So if you don't have the information you need to participate in consultations like this, you're just going to opt out and not have your voice heard. So it's really important that disabled women also have their voice heard around issues like abortion and can participate in the review just like everybody else. So that's why this plain English guide was really important, and I was involved in creating it myself and in speaking to advocates around creating the information themselves. They were so grateful that, you know, they were being considered in this important subject, and that their voices were being considered as important. And it's fair to say that accessible information, or plain English in particular, is very useful for many people. You don't necessarily have to be a disabled person to access it. Many of us might want to access plainer language if English isn't our first language, or if we're just having difficulty with some of the terminology or language within a document. It can be such a help to have a plainer or simpler way of describing the information. But it's also very important to ensure that all of the information is present, and that people have the same access to the level of information and to the complexity of the subject. So just because something is in plain English doesn't mean that there is information that's absent. It's just described in a slightly different way to aid understanding. And sometimes when we are in the realm of rights and in the realm of speaking about subjects like abortion, and we're used to the terms and we're used to the subject, we forget that others may not have the same understanding of the language itself. So it's really useful to have different formats so that people can access the consultation. And as you said, Faye, this is about everybody having their voice heard, no matter what their opinion may be, but to also ensure that the voices of minorities are heard within this as well, and that people have the access they need to the consultation. And we will of course be promoting the consultation as well, so that people know that it's there, because it's no good doing all the work and having accessible information and then people not realizing that it's there. So promoting it is part of the work around it too. And we will hope that many disabled women and people that want to access plain English will be able to now participate in the consultation as a result, and we will get a lot richer information and experience as a result of that. And that's really important. So I think that's all I have to say, really. Thanks a million.
Thank you so much for that, Julie, and well done for all your work on the plain English guide. It is really, really important. And I think something that we know about this legislation is that it disproportionately affects disabled women. So it's really important to make sure that their voices are coming through in this public consultation, and that we're listening to them. So you're really helping with that. And just to confirm to everybody attending, we will be sending around both versions of the guides to everybody who's registered, so you'll receive them. So thank you so much, Julie. So now I'm going to present the quick guide. I'll just share my screen here. Okay. So we developed this quick guide, like I said, to make sure that kind of all the information that you need to submit to the public consultation is it just in the one place. We know from feedback that it can be very difficult when you're not sure what the questions mean or where to find the information. So we're really hoping that this kind of answers all of your questions. Just a reminder, if you do have any questions about anything that's come up so far or in the guide, to use the Q&A function, and we'll have a few minutes at the end to go through that. So we did the guide in two parts. The first part being the kind of more practical section on what is the review and how do I make my submission. So hopefully that will answer any kind of practical questions that you have. Part 2 then is the supporting information about abortion in Ireland. So the statistics and what are the current barriers and what's working well as well. So I'll start with part 1, which is what is the review and how do I make a submission? So our speakers have really outlined this already, but just to address why it is important to have your voice heard. Repeal really was one of the most important political and social movements in the history of the Irish state. Tens of thousands of activists came together across the country, knocked on doors, got out there and really made the case for women and pregnant people to be able to choose for themselves. Unfortunately, the current law doesn't honour this spirit, and we still have a series of obstacles and barriers that do prevent women and pregnant people from accessing abortions. They do disproportionately affect the most marginal and vulnerable people in our society. So this public consultation is a really important opportunity to review these laws and look at how we can do better for women and pregnant people in Ireland. It's also an important opportunity for the voices of people impacted directly by the law to be heard, and to remind politicians and the government of that movement that was so important and transformed our society for the better. So what does the law actually say? And I think this is really important because this is what the consultation is about and what the review is about. So it's really important that we're clear on what it actually says. So currently abortion is allowed in these circumstances, so up to 12 weeks on request. And so that means anybody who wants an abortion under 12 weeks can go to their GP and they can request an abortion. There is a mandatory 3-day waiting period after the initial consultation before the abortion pills are provided. So this is set out in the legislation that there has to be that 3-day waiting period. And I will talk a bit later on about why this is problematic. After 12 weeks, then abortion is only allowed in cases of a risk to the life or health of the woman or pregnant person, or in the case of a fatal fetal anomaly, where the fetus will die before or within 28 days of birth. Again, Sydney gave a really good overview of why this is problematic and how a lot of people are still having to travel to receive abortions. So medical practitioners are not obliged to carry out abortions if they object due to their personal beliefs, and this is known as conscientious objection. And really crucially, it is a criminal offence for anybody to support access to or to provide an abortion outside of the scope of this law. And this carries a sentence of up to 14 years. And this is really serious and something that we need to see decriminalisation, because we voted for women to be allowed to make this decision with the support of their doctor. And we should not be criminalising doctors for trying to provide healthcare. So what is the public consultation? So the Minister for Health is currently carrying out a 3-year review of how the law is operating and is looking for the views of the public to inform this process. So what I mean when I say how the law is operating, the review is really looking at how it's working in practice. But again, as I will talk about in part 2 of the guide, a lot of the problems with the law, how the law is operating in practice, is directly related to what is set out in the law. So we feel strongly that they are intrinsically linked, and a review of the operation of the Act needs to take into account the parameters of the Act itself. So as I said at the beginning, this is open to anybody who wants to make a submission. So whether you have had an abortion yourself, have supported a loved one through an abortion in any way, have been a patient escort, whether you're concerned that maybe one day you will need an abortion, or if you will never need an abortion, but you want to be an ally and support those who may. So we wanted to just set out the questions that are in the consultation form, because like I said, it can be quite intimidating when you go in and the language is quite formal, and we just know from a lot of feedback that this does put people off. So this section of the guide is just setting out what the questions are and what information they're looking to gather and how you can answer them. So the first few questions do ask things like your name, which you do not have to answer if you do not want to, but the main questions are set out here. So to what extent do you agree that the Act has achieved its aims? So this is a question on a scale from strongly disagree to strongly agree on whether you think the law is achieving its aims. So you can hopefully use this guide and your own judgment, maybe your own experience, to answer that on a scale of whether you think it is achieving its aims to provide abortion in Ireland. The next question then is, are there parts of the Act which, in your opinion, have not operated well? So this is a yes or no question with a follow-up question to elaborate on this. So really what this question is looking to gather information about is with the problems with abortion, those barriers that I was talking about, the obstacles. So this is a really important opportunity to set out those parts of the law that aren't operating well. So like I said, in part 2 of this guide, you can draw on the barriers to abortion that we've provided, as well as the statistics. The next question then is, are there parts of the Act which, in your opinion, have operated well? Again, this is a yes or no question, and you can follow up to support your answer. Again, we have a lot of information in part 2 of this guide that you can use to support your answer. Of course, if you have personal experience, you can use that as well. If you don't think any parts of the Act have operated well, you can answer no, and again, elaborate maybe on what you had said in the previous question. And then there's 2 final questions that provide an opportunity for further comments. So you can provide further comments on the operation of the legislation. Again, that means how abortion is being provided in line with what is set out in the law. And you can refer back to that section of this guide to make sure that you're very clear on what is set out in the law. So you may want to share a personal experience or that of someone you know, or your experience as an abortion provider. If you don't have anything else, you can leave it blank. You can also provide further comments on services provided under the Act. So this is a really important opportunity to give some information or some experiences about the actual services, so whether they're GP or maternity hospitals. Again, if you want to share a personal experience or that of someone you've supported, you can do this as long as it relates to working in abortion services. So the deadline for the close of the public consultation is 1st of April, which is in 2 weeks. So that's close of business on the 1st of April, which will be 5 o'clock. And they will not be submitting any, or they will not be accepting any submissions after that. So it's really important that you keep the deadline in mind and get your submission in before then. You can submit in one of 3 ways. So by submitting an online form, which is linked in the guide. So once I send this around, that will be available to you. You can download the form and then email it to this email address here with the subject line "Review of the Operation of the Act." Or you can fill it out by hand and post it to the bioethics unit of the Department of Health. The department has stated that it does intend to publish submissions on its website, but there is an option for you to not consent to having your submission published. So part 2 of the guide now, I hope that has answered any questions you have about the consultation itself and the review. And I hope you feel confident now filling out the form. And now we'll just move on to the supporting information, because it is really important that your submissions are evidence-based. And especially if you don't have personal experience yourself, the statistics are there, the research is there, and it's really important to highlight that in your submission. So just to highlight some of the kind of key statistics that we have. So currently only 1 in 10 GPs are providing abortion. So this is really low coverage for 4 years on from repeal. And there's a number of reasons for this, which I will talk about in a little bit. And in 2020, for every 3 women and pregnant people who attained an abortion because of a fatal fetal anomaly, 2 had to travel to the UK. So in 2020, 97 people had an abortion because of a fatal fetal anomaly, and 63 had to travel to the UK. So these are still really high numbers. And again, this is not what we voted for. Nobody should have to be traveling in such cruel circumstances to another country because of a fatal fetal anomaly. It's not right. In total, 194 women and pregnant people from Ireland travelled to the UK for an abortion in 2020. And this is during a global pandemic. So they're putting their health at risk to travel to the UK for abortion that should be available at home. So only 10 out of 19 maternity hospitals, so half, are providing full abortion services. Maternity hospitals are publicly funded, which means they should all be providing this service. And again, there is a variety of reasons for this, and we need to make sure that all maternity hospitals are providing full abortion services so that they are available to anybody who needs them. The Abortion Rights Campaign, who are one of our colleagues in the Abortion Working Group, conducted research with abortion service users, and they found that 30% of the respondents travelled between 4 and 6 hours to receive abortion care. So again, this is going back to that lack of coverage, the lack of GPs who are providing abortion, and the lack of maternity hospitals. And nobody should be travelling that long to receive vital health care. Almost 1 in 5 respondents from the same research were refused care. And this can cause a lot of delays in people accessing abortion, especially if they're under 12 weeks. So to answer the question of what has not operated well, we've put together some of the barriers that we know are causing obstacles to abortion from the work of the Abortion Working Group. So first of all is the 12-week limit. So the limit on providing abortions in early pregnancy is strictly set to 12 weeks, and that is not a day over. So to provide some background, 12 weeks means the date of your last period. So it's really 10 weeks from conception. And many people only realize they're pregnant at 5 or 6 weeks. So there is this really kind of sense of urgency and this time limit at the moment. And there's a lot of reasons why this is a barrier to receiving an abortion. Like I said, there's the mandatory 3-day wait, the lack of GPs providing abortions, which causes delays, the lack of information for adolescent girls who are pregnant, and the impact of failed abortions. And Sydney spoke a little bit about that at the start, but if somebody has, a failed abortion and they're then over the 12-week limit, and they only find out post 12 weeks, they cannot access abortion in Ireland. And it's really important to point out that a longer limit doesn't mean that more people will access abortion at a later point. The data that we have from England and Wales, where their limit is 24 weeks, shows that in 2020, 94% of abortions were under 12 weeks. So next, on abortion for post 12 weeks, on the grounds of the risk to health. So abortions after 12 weeks may only be carried out if there is a risk to the life or serious harm to the health of the pregnant person, or in the case of a fatal fetal anomaly. However, we know that numbers are very low for the amount of people accessing abortion post 12 weeks, in fact, similar to what it was before we repealed the 8th. So this suggests to us that this is being interpreted in a really narrow way. And most women who did travel abroad for abortions since 2019 did so because of the risk to their health. So this is really concerning to us, and it does show us that not everybody that needs abortion in Ireland is able to access it based on what is set out in the law. The other grounds then post 12 weeks is under fatal fetal anomalies. So the law says that an abortion can be carried out after 12 weeks in the case of a fatal fetal anomaly. However, 2 doctors have to certify that the fetus will die within 28 days of birth. In many cases, they can predict that the baby will die soon after birth, but it is very difficult to say that it will be specifically within 28 days. So as a result, many women are unable to access abortions, and in 2020, 63 women were forced to travel to England and Wales for an abortion. Again, putting their health at risk during a global pandemic. And we don't know how many have traveled to other countries and without receiving any clinical support or aftercare. Next, another barrier is the 3-day wait. So as I've said, this is mandatory and is set out in the law that when somebody goes to their GP to get an abortion, they must wait 3 days. And it's This is not always 3 days because you have to take account of weekends, bank holidays, public holidays. And because of that 12-week limit, there is a sense of urgency, and that can cause delays to accessing abortion. It also puts stress on women and undermines their authority, their autonomy, and their decision to have an abortion for whatever the reason is. It is also contrary to the World Health Organization guidelines on abortion. Next is the criminal liability for practitioners. So abortion is recognized as an essential aspect of healthcare by the World Health Organization. And as we set out in the summary of the law above, the maximum sentence for providing or assisting with an abortion is 14 years. This criminalization is a really chilling thing, and it really undermines doctors' clinical judgment and professional expertise. And it's really important that we're kind of making the connections between these problems. And if you look at something like the low number of GPs who are providing abortions, the criminalization of providers might be having an impact there. So the absence of safe access zones. So unfortunately, anti-abortion activities outside of abortion providers are still happening on an almost daily basis. There is really strong evidence that this has a distressing, stressful, and traumatizing effect on anybody who is trying to access abortion, as well as their healthcare providers and the staff that are providing the care. Safe access zones were promised in the referendum in 2018, and they must be delivered. And our colleagues in the abortion working group, Together for Safety, have been doing amazing work trying to get safe access zones introduced. So if you are interested in this, I would recommend that you look up Together for Safety to see the work that they've been doing. The poor geographical coverage, again, we know that in some counties there are no GPs who provide abortions, meaning anyone that wants to access an abortion must travel to another county. So combining this with the 3-day wait and the 12-week limit, they will have to travel at least twice if the initial consultation cannot happen over the phone. And this does disproportionately affect rural women. Another barrier is the lack of monitoring of conscientious objection. So it is illegal for institutions like publicly funded maternity hospitals to conscientiously object to abortion, but the fact that only 50% of maternity hospitals are providing abortion services does suggest to us that conscientious objection might be a factor in this poor coverage. Being refused abortion services because of this causes delays and stress to people who are trying to access abortion. While individual medical practitioners can refuse to provide abortion, and that is their right, they should be providing timely referrals to an alternative provider. And this would be in line with the guidance from the Irish Medical Council. Another thing that concerns us is the lack of data. Good quality data really is essential to ensure monitoring and evaluation of abortion services and making sure that they are responding to needs. We do not have a national database that captures things like refusals of abortion care, how these people are being referred to alternative care, breakdown of abortions by location, or type of abortion provided. And it makes things like doing a review really difficult because there's very limited data there. So we would recommend that a national database be implemented. Next up is the providers of abortions. So there's a very limited amount of healthcare providers who can provide abortion in Ireland, and this is a barrier to safe abortion care. The current delivery does restrict provision to doctors. However, in other countries, we know that nurses and midwives can safely provide or be involved with provision of early medical abortion. There is a PPS number requirement to access abortion in Ireland, and this means that abortions can only be provided for free to women and pregnant people who have a PPS number. And many people living in Ireland don't have a PPS number, whether they're an asylum seeker, residents in Northern Ireland, or anybody living temporarily in Ireland or of a migrant background. So this means that they may have to pay, they may be forced to travel to access an abortion, or they may be forced to continue with the pregnancy. And then translation services. So there is a lack of HSC interpreters for service users with limited English. And that can be very stressful for anybody who doesn't speak English, you know, and it can be a real barrier to them understanding what the process is, communicating their needs, and being able to access abortion. So there are things that are operating well, and you can use this slide here to answer that question in the public consultation. So one thing that is operating really well is telemedicine. So during the course of the pandemic, telephone and video consultations were introduced, and this has been really positive and really positively received. So this makes sure that there's a reduced need to travel, and it gives people a lot more privacy, particularly rural people. It's been particularly well received by the disabled community, and it's very important as well for example, somebody who is experiencing domestic violence, you know, to give them that privacy and make sure that they can do the consultation within their own home. We do want to acknowledge the dedicated healthcare providers who are providing abortion. Although the numbers are limited, we know that doctors and healthcare professionals who are providing services are very committed, compassionate, and do understand the urgency because of what we have set out in the law. You know, we know that that is a really positive thing. So we do want to acknowledge you know, all of their work and support. Another thing that has worked really well is the My Options. So My Options is the national free helpline where women and pregnant people can call and receive the name and phone number to specific providers near them. So we know from research that a lot of people have had really positive experiences of My Options. There is a bit of a problem in that a lot of people don't know that My Options does exist. So we would recommend kind of increased investment into this service to make sure that everybody knows that it is available and that they can access that, because we know that it's been something that's really positive. So finally, I just wanted to highlight some of the resources that you can draw on in your submission and that we've drawn on to put this quick guide together. So the first one would be the Abortion Rights Campaign paper on Too Many Barriers, Experiences of Abortion in Ireland After Repeal. The National Women Council's own paper on accessing abortion in Ireland, which we published last year. There's an upcoming paper by the WHO on access to safe abortion services in Ireland, and that will be available shortly. And as well, you can use the WHO's guidance on abortion. So I do just want to thank my colleagues who helped me put this guide together. We did it as a subgroup of the Abortion Working Group. So I do want to thank Sinead Kennedy and the Union of Students in Ireland, as well as my colleague Alana Ryan for helping me to put this guide together. If there's any questions about anything that you don't get answered in this webinar, you can contact me at faw@nwci.ie. Stop the share now. So I'll just invite our speakers to turn their cameras back on, and we'll have a look at some of the questions. So there's a question here about GPs and providing abortions. So the question says, when you say that GPs are not providing abortions, does this include not prescribing morning after pills or pills which work for abortions within the 12 weeks? Also, are pharmacists refusing to dispense such prescriptions? So when we say that GPs are not providing abortions, we mean that they are not advertising that they will accept clients to come in for consultation and give them the prescription for the abortion pills. So this has nothing to do with morning after pills. This is about the provision of abortion itself. So as I said, that is 1 in 10, which is really low. And then the question about pharmacists, I don't believe we have any data on that, but you know, I do think pharmacists would be covered under the conscientious objection. But like I said, it is really important that for anybody who doesn't support access to abortion, that they provide an alternative provider so that somebody can access those pills straight away. There's a practical question here on, is it better to reference the data you provide, or can I highlight the research that highlights the importance of access? Happy to do whatever is best for the process. So you can include anything you want in your submission. This really is just a guide to, you know, helping you to submit and making sure that you know what the information is. You can include any research you want in it. Yeah, so you can draw on your own experience as well. If you have psychological research, you can include that. Like I say, it is just really a guide. And of course, you don't have to include everything in the guide. There's a lot of barriers there. So whatever kind of stands out to you, you can include. So it's really up to you. And any submission is better than no submission. Sorry, just going through. Another kind of more practical question here. In order to submit successfully, can we use the language in this presentation directly? I'd be self-conscious of my own wording, and I would like to use the wording that has been used here. Also, may we reference these reports in our submission? So you can absolutely use your own language, but you can use the language of the guide as well. We are a little conscious that we don't want kind of, you know, very copied and pasted answers and everybody's saying the exact same thing. But again, you can use whatever language you are comfortable with. You know, it doesn't have to be perfect, and don't worry about language or anything like that. The important thing is the information, and that you are, you know, referencing any statistics, you're referencing the research to ensure that when they're pulling all of the submissions together, that they know that this is evidence-based, and that they know that this is, yeah, it's evidence-based and it's from research, and this is what is happening. So I hope that that has answered that question. So there's a question here about fetal anomalies. So are parents who receive a diagnosis of a fetal anomaly still required to go to full term before they can be induced? So anybody who is covered under the grounds of fetal anomaly, where the two doctors do certify that the baby will die within 28 days, they can have that abortion, you know, whenever they choose, and they don't have to go to full term. And if they're covered by the law, they can make that decision with their doctor and decide what is best for them. And just some comments coming in from people thanking the guide for pointing out the issues. So a question here from my psychologist who says, I am very aware of the research that demonstrates the needs for people to have access to abortion. My questions are: 1, does the method of submission make a difference? And 2, is it better to have multiple signatories on a submission, or is it better for everyone to make their own submission? So just on the method of submission, no, I don't believe that it does make a difference. The important thing is that you're using, that you are answering the questions that are set out, and you know, making sure that you are referring back to the legislation itself, and you know, hopefully the guide has helped with that. And then on the question on having multiple signatories, you can do this, and this is something that we have done ourselves in the abortion working group. We submitted collectively to the public consultation. So it really is up to yourself whether you have multiple signatories on a submission or everybody makes their own. Again, what's really important is to just make sure that the information is clear, evidence-based, or based on your own experience. Question here about can people in other countries make submissions? So again, this is open to anybody. So whether you're a resident in Ireland or not, literally anybody. So yes to that question. If you're in another country, you can make a submission, and we really would encourage anybody who, anybody at all who cares about improving abortion in Ireland to submit. Another question here on what is the best way to help improve the services available, and where is the submission and form available. So there is a link to the online form within the quick guide. As I said, I will send that around, but it is also available on the National Women's Council's website. And what is the best way to help improve the services available is to submit to the public consultation. This is really an important opportunity, and we need to just reflect on how this law is operating. Yeah, we're really hoping that, you know, this will make a real difference and it will improve services. And it is a really important, you know, it is the first opportunity since repeal to help improve the services. So this review is the best way to help improve that, and, you know, hearing everybody's voice and letting the government know how important this is to you, and how much you care about this, regardless of what your experiences have been, and that is the best way to help improve the services. Sorry, I'm just going through some of the questions now. There's quite a few here. And also, if any of the other panelists have anything to say, please feel free to jump in at any point. And there's another question here about, do you have to fill in the online form in just one go, or can you save a form to be completed later? So if you do want to kind of fill it in at different points, the best way probably would be to download it, and then you can save it, you know, to your computer or whatever, and then email it in. You know, it just would be a shame if you went to the online form and then you lost any of what you put in. So if you want to kind of fill it out over time, I would recommend that you just download the form. It shouldn't take too long, and hopefully that is, you know, that is the goal of providing this quick guide, that it's going to be as quick and painless a process for you to fill out as possible. There is a question here about it being a 3-year review and why not a 1-year review. So it was set out at the time that the minister would review the law after 3 years from the commencement of the law. So the law did commence on the 1st of January 2019 year. And there's a comment here from somebody saying, glad to hear that there is a plain English guide. I don't have a disability, but bureaucratic jargon is defeating me. I'm a woman in my 60s and so will never have an abortion, but I think the consultation isn't really asking for my opinion, so it's hard to make my view count. Thank you so much for that comment. It's really good to hear that the guide is useful. And the plain English guide as well. And, you know, again, well done to Julie for all your work on that. Yeah, the feedback that we got is that the bureaucratic jargon does put a lot of people off. But hopefully from what we've set out in the guide, it'll make it a lot easier for you to make your submission. And again, there's no wrong way to do it. You know, you can take bits from the guide, from the resources, whatever you want. And this is not just for people who have had an abortion or will need an abortion. This is for everybody. If you care about improving access to abortion in Ireland, you need to have your voice heard. So we really would encourage anybody at all from any community, any walk of life to make sure that your voice is heard. And there was a question there earlier, are Irish women still traveling to England for abortions? And yes. Okay, just a few comments coming in, but I think that's mostly everything. If anybody does have any additional questions for any of us, my email is faw@nwci.ie. If you need any additional support, filling out the public consultation, the submission, anything like that, feel free to email me. I'd be really happy to help. There is still 2 weeks to go until the public consultation closes, but we would encourage you to get your submission in, as quickly as possible, and make sure that you're also telling your friends and your family and anybody that you think would care about this, that everybody's voice is really important, and that anybody can submit. So if everybody who is here could share the guide, let people know about this webinar, and let people know about the consultation, because we have been doing a campaign in the National Women's Council to make sure that people know this is happening, and it is really important that everybody knows that this is happening, and we do have this really important opportunity to improve access to abortion, and to improve the services, and just go further with it, because we've come so far. And Sinead, I think you gave a really good overview of what we can achieve together, and we know that change is possible. So I think this is just a really good opportunity for us to just improve that and keep moving forward in a really positive way. I'm just reading some of the comments there. Yeah, so thank you so much for all of the positive comments. I really hope it is useful for everybody, and that you do submit. It would be great if anybody uses the guide to make their submission, if you could let us know, just so that we know that it has been helpful to you and that you did submit to the review. And then there's just a question about sharing around the materials. So I'll email everybody that's attended here today with the plain English guide, as well as the general quick guide. Okay, so we'll wrap it up there. I just want to say a huge thank you to our speakers today, Sinead Kennedy, Sydney Calkin, and Julie Helen, for giving up your time to be here with us today. Really, really appreciate it, and you all spoke really well, so thank you so much. I'd also like to thank our ISL interpreters, Vanessa and Sarah, for their support with this event, and I hope that that's benefited some of you out there. And of course, to everybody who came along today, thank you so much for giving up your lunchtime. I hope this has been informative, and I hope that the guide helps you to make your submission. Like I said, if everybody could let people know, share on social media, share our posts with the hashtag abortion review, and let's keep that spirit of repeal going, and let's make sure that people know that this is happening and that we're all coming together for change, for positive change. So thank you so much, everybody, and I hope you enjoy the rest of your day.